everybody, this is Tess with Roe Dental Lab. I'm out here with Dr. David Todd in Lakewood, New York. Dr. Todd, why don't you tell us a little bit about your practice?
I'm an oral maxillofacial surgeon in Lakewood, New York in the southern tier. And I have a pretty traditional oral surgery practice. We take care of a lot of patients with a variety of problems, managing wisdom teeth, managing infections, doing many extractions, and of course placing many implants, and very interested currently in full arch treatment solutions for our patients.
Great, and tell us a little bit about how you got started with CHROME or how you heard about the system.
So we had been doing a number of full arch treatments for our patients prior to using CHROME, and although we were successful, we found it somewhat cumbersome to do the correct amount of bone reduction, to place the implants precisely relative to certain anatomy, and then converting the dentures into temporary full arch cases was pretty cumbersome. So we were aware of digital solutions and became aware of Roe's product, and found it much easier to precisely perform the bone reduction, precisely place the implants, and then placing temporaries that are pre-designed, digitally fabricated and designed for that particular patient is a very easy process. So the occlusion, the lip display, the tooth arrangement is all predetermined, and it's much stronger than the conversion process that we were carrying out before. So we found it to be a very efficient way of and very precise way of delivering these cases for our patients.
And what has been the biggest benefit, Dr. Todd, of utilizing CHROME in your practice?
I think the biggest benefits are to precisely deliver the product to the patient in a very predictable way. So the case is digitally planned, the bone reduction is digitally planned. We can deliver a temporary prosthesis in a very predictable way so that the occlusion, the tooth display, the vertical dimension is all predetermined, and we have very strong temporary for the patient. So the predictability is very great. Secondarily, for our restorative partners, the fabrication of the final prosthesis is much easier than other methods. We use a rapid appliance intraoperatively and pick up the implants. The patient then is delivered a temporary. When the case is ready for final delivery, the general dentist can utilize the rapid appliance to verify the occlusion, verify the tooth display and vertical dimension, and then by just picking up the intaglio of the soft tissue change and the prosthesis, we can develop a prototype in a very short amount of time. The prototype then verifies all the aspects of the case we want to create, and then the final prosthesis can be made. So the fabrication of the final prosthesis is much simpler and much more predictable.
And how does the team at Roe help you prepare for these cases and get you guys ready for surgery day?
So it begins with digital planning. We look at the case, of course, and have discussed the case with Roe. And typically they do quite a bit of workup before we attend an online meeting. We then finalize the bone reduction, the implant position relative to pertinent anatomy, and then the case is planned. Temporaries and rapid appliances are generated. And then we've utilized chairside assistance from people like Thomas Kuhn and Alan Banks, who have vast expertise in this technique. So troubleshooting problems intraoperatively is very helpful having them chairside. Typically, once the rapid appliance and the temporary have been picked up, we deliver those to our on-site laboratory technicians. And while we're closing the case, they're finalizing the temporary for us, so we can deliver that shortly after we close the case.
Got it. And I'm gonna kind of ask you a surprise question here, but what piece of advice would you give to a surgeon or a specialist looking for a full arch solution who might be looking into CHROME?
I would say my advice would be to try this product and try the chairside assistance. I think many surgeons have placed a lot of these cases conventionally, quote unquote, by hand, and I'm sure they're quite good at it, but I think you'll find the predictability and the ease of which you can deliver these cases is much improved with this process.
Great. Well, thank you so much, Dr. Todd. We look forward to continuing to work with you and your team.
Thank you.